Hi everyone, my name is Rosie and I did my video presentation on cerebral palsy. Cerebral palsy is defined as a group of permanent disorders of development of movement and posture, and this is caused by damage to the fetal or infant brain, which can cause activity limitations. However, it is a non-progressive disorder, meaning that there won't be any further brain damage or symptoms of that brain damage. Cerebral palsy, also known as CP, is the most common motor disability in childhood. About 1 in every 323 children has been diagnosed with CP, and it is more common in boys than in girls. I have a bar graph here that shows the prevalence in 8-year-olds among 4 different states, and there is an average of 3,100 children in each state at 8 years old diagnosed with CP. There are 4 main types of cerebral palsy. The first is spastic, and about 77.4% of children diagnosed with CP have spastic CP. And it's defined as having high muscle tone, also known as tight muscles. There are 3 types of spastic CP. The first one is spastic diplegia, in which case the tightness or stiffness is in the legs only, and walking can be difficult because the hips are often so tight that the legs are internally rotated and the knees knocked together, causing a type of walking called scissoring, which can be very uncomfortable. The second type of spastic CP is spastic hemiplegia, in which case only one side of the body is affected, and the arm is usually more affected than the leg. And the last type of spastic CP is the most severe. It is spastic quadriplegia, which affects all 4 limbs and can also affect the face and mouth. Oftentimes there are other disabilities with spastic quadriplegia as well. Ataxic is another form of CP, and it affects an individual's balance and coordination. So walking can be difficult. Also, fine motor activities such as writing may be difficult for individuals with ataxic CP. And then there's dyskinetic CP, in which case muscle tone can vary from day to day or even within the same day. So an individual may wake up with very tight muscles and then later in the day they become a lot looser, or vice versa. And these individuals have difficulty with controlling movements in all 4 limbs, face and mouth, because these movements are uncontrollable. So activities such as sitting, walking, talking, and swallowing can be very difficult. And then lastly, mixed CP is when an individual has symptoms of more than one type of CP. So spastic dyskinetic CP is the most common. And I have a photo at the bottom that shows the 3 different kinds of CP where the brain was damaged, and it highlights on the mannequins where in the body, so what limbs are affected. And then how CP is diagnosed. So there are 3 main stages. The first one is developmental monitoring. So a parent takes their infant into the doctors for routine checkups, and this is where the parent can voice any concerns that they're seeing at home with motor or movement delays, and the doctor can observe these, and if they feel that the child needs some developmental screening, they can test for motor and movement delays at 9 months, 18 months, 24, and 30 months. So cases of mild CP may be difficult to observe at 9 months. However, at about 18 to 24 months, these cases of mild CP can be seen, in which case they then go to developmental and medical evaluations. So with the goal to diagnose the specific disorder. So at these evaluations, the doctor or specialist will test the child's motor skills, muscle tone, reflexes, posture, and take an in-depth family medical history. And then if they want to pinpoint a cause of the disorder, they can do brain imaging testing such as a CT scan or an MRI or a combination of any of the other brain imaging tests I've listed at the bottom. So CP is a lifelong condition. There is no cure, but there are medications and treatments for all the various systems that CP does affect in an individual. I have listed here 4 categories of medications. and how exercise may affect them or how they may affect exercise. So antispasmodics and muscle relaxants can cause sedation, nausea, dizziness, or loss of seizure control. Anticonvulsant medication may cause fatigue, dizziness, a decrease in cognitive function. Anti-seizure medications may depress the CNS, which is contradictory to exercise because during exercise we want to excite the CNS. And lastly, anticholinergics or dopaminergics can cause dry mouth, constipation, agitation, dysuria, which is discomfort urinating, and exercise may increase all of these side effects. So, should individuals with cerebral palsy exercise? Well, the answer is yes. Exercise for individuals with CP, like the general public, can increase and maintain heart and lung efficiency, maintain strength, flexibility, motility, and coordination. Exercise can also improve and maintain bone structure, strength, and reduce risks for several chronic diseases such as osteoporosis and high blood pressure. So physical therapy is often the first step in treating cerebral palsy. There are certain responses to exercise that individuals with CP may experience. The first is incontinence. So they may not have control over their bladder while exercising. They may experience cognitive or behavioral problems, in which case their therapist or exercise instructor should ask precise and short questions. They should give the individual time to adjust to a new task. So repetition of activities is very important. And lastly, limit the amount of instructions given at a time to kind of help with some of that cognitive and behavioral problems there. And then musculoskeletal problems can occur. So fractures, hip dislocation, leg length discrepancies, and bone loss are common among individuals with cerebral palsy. So while exercising, it's important to only use weights and weight bearing when appropriate. Swimming may be a good alternative activity for individuals who are prone to fractures. Hip dislocation is another important musculoskeletal problem to be aware of, to not put too much pressure or strain on those hips in individuals who have had hip dislocations in the past. Oral motor dysfunction is another important response. Dysphagia is the inability to swallow, so excessive drooling may occur. Providing a towel can help with that. Dysarthria is the inability to pronunciate or speak clearly, in which case asking simple yes or no questions in which they could shake their head yes or no would be beneficial. And then seizures and epilepsy are common with CP often, and so understanding how the medications of those work with exercise and knowing what to do if someone has a seizure during exercise is very important. And lastly, sensory and perception impairments may occur, so just limiting the amount of instructions given at a time and giving cues for each activity are important rather than giving the individual the entire program at once. That may overwhelm them or frustrate them during the exercise. So the exercise prescription. Cardiorespiratory modes can vary depending on the individual's ability. So anything from walking, running, cycling, propelling in a wheelchair, swimming again, hand cycling are all very beneficial. Swimming may be a preferred method for individuals who have high tone because the warm water can loosen that tone a little bit, and vice versa. Cool tone may help somebody with low tone. So intensity for cardiorespiratory should be started at about 40 to 50% VO2 reserve. This is considered moderate intensity, and they can progress to about 50 to 60%. The frequency should be about 2 to 5 days per week, and 30 minutes a session is the goal. However, due to fatiguing, it may be more beneficial to break that up into 3 10-minute sessions throughout the day. And then resistance training, so machines and resistance bands are the preferred method. However, if the individual has the balance and stability, then free weights may be used under supervision. Repetitions for resistance training should be done to fatigue, which means low weights, high repetitions. Until they progress a little bit more, they can start to use higher weights with lower repetitions, and these should be performed 2 to 3 days a week, non-consecutively. And 3 sets of 8 to 15 reps should take the individual to fatigue for each exercise. Lastly, range of motion should encompass passive and active stretching. An example of this could be P&F stretching. The intensity should just, the stretching or range of motion activity should be held until a slight point of discomfort. And this should be used as a warm-up or cool-down for other activities or exercises. So the frequency depends on how often the individual is doing other exercises. And each stretch should be held for 30 to 60 seconds, about 5 or 10 times each. There are some modifications and special recommendations for individuals with CP. Cardiorespiratory special considerations include proper support and positioning, checking the skin for any rubbing or irritation, swimming again if there's a high risk of fractures. And then for resistance training, just ensuring sufficient joint stability and range of motion to perform the exercises correctly and avoid injury. And then for range of motion, again, just ensuring that joint stability and ensuring that they are getting the full range of motion that they're capable of. Motility devices possibly needed could be walkers, wheelchairs, crutches, or orthotics for feet, ankle, hip, or knee support. And the case study I did, it was on a patient who is 3 years old. She's a female. She has spastic diplegia, meaning, again, only her legs are affected. She uses a walker. She was unable to walk prior to the introduction of this walker. She can crawl independently. She does use ankle orthotics and is not on any medications at this time and has not been diagnosed with any other disabilities. Her risk stratification, she is prescribed physical therapy twice a week for 1-hour sessions each. However, she is given exercises to do at home every day for the days she's not in physical therapy. So walking without a motility device for her is unlikely. However, she's learning to use and move efficiently in her walker and build the strength in her legs. Her risk group right now is walking difficulties. However, with age, she may experience arthritis, hypertension, or osteoporosis. And so her goals are to increase strength, promoting independence through crawling up and down the stairs on her own, and eventually progressing to walking with crutches. Special considerations for this individual would be her age, so keeping in mind typical milestones and just ensuring that ankle, knee, and hip support. And in conclusion, exercise for individuals with CP is as beneficial to them as the general public, and in addition to that benefit, they will also receive the reduced pain from the tone, so adjusting exercises to help adjust their tone, whether it's high or low, can help ease their activities of daily living. And it's also important to plan the exercise and activities around their medications and keeping those special considerations in mind to ensure the safety and effectiveness of the exercises. And lastly, just keeping in mind that individuals with CP are all different and everyone has a different need. So each exercise prescription and program should be tailored to their needs and individualized treatment prescriptions for each person. And these are the references I used. Thank you.